This gives you a sense of, with somebody who is struggling and has a patient who is serious, the kind of despair and the problems that they have to go through. Reality checks only to make sure that the authorities take a look at it and try and improve the response system. Dr. Sarin is joining us right now. Dr. SK Sarin, welcome to India Today. Thank you so much for speaking to us, sir. I just want to understand once again, sir, why is it that we are seeing once again such huge spike as far as the COVID cases are concerned? This spike is even bigger than what we saw in May and June, sir.
You have a very valid question. Everyone is asking the same, but the question should be asked to oneself. You realize the effect of lockdown, whatever we may call it, for a few weeks had a astounding effect. I mean, the number of cases had come down. The contact tracing was in full effect. And everyone thought citizens in Delhi are behaving very well. Delhi is a very civilized, educated, and motivated society. But Delhiites proved themselves wrong. They, in fact, came out in open and flouted all the norms of, what you can call as a corona appropriate behavior. And we are seeing the results of that. And I think we ourselves are to be blamed to a large extent in this, whether we are moving in a metro or a bus or going out, taking out the mask, not wearing it. So all of you know that. But I want to say that the wave is not really that we had the R0, the reproduction number never went down to negligible. The lowest numbers are close to 1,000 cases. So we had a residual infection. And you know that these infections can spread very fast. Countries like Korea, where there was no case, countries like Australia, no cases, still, they had a wave because there was some subclinical infection there. You go out to a nightclub and next week, you have all these corona cases. So I think we had a residual, a large number of people infected, and we had a surge, which is serious.
Sir, do you reckon that, the fear that people had initially of COVID-19, because possibly of the efforts and maybe some sort of COVID fatigue also set in, that people started thinking that they would not, get infected, or is it okay just to step out? Because right now, just before Diwali, markets were full as if we were in the pre-COVID era.
Yes. Ankit, you're absolutely right in that. And I can only say one thing, that we are safe as long as all of us are safe. We are protected as long as everyone else around us is protected. If others are not protected, then I can spread, you can spread the infection, and people had forgotten that corona is coming for the first time. We have no immunity. Our body's immune system has no memory of such an infection, and therefore people have clearly to be blamed. They have forgotten. In fact, I was surprised that there were so many crackers pre-Diwali and on Diwali day. And crackers, as you know, will explode places. And the virus, if someone is infected and also has, used or played a cracker, the virus will go to maybe many hundred yards, and it can remain in the air. And that probably, my next fear is that Delhi may see more cases. I hope not. I hope I'm wrong. But next 4 weeks may be really a true test for us. I would like to give few messages through you, which I have tried, and I've now tried to concentrate 3 areas. I heard what you were telling about hospitals. I have 3 messages. One is for people, one is for yourself, the person, and third is for hospitals and others. Let's first start with myself or the person. I will list out how you can, despite this surge, remain protected. We don't want deaths. Delhi touched about 100 deaths. Painful, everyone. So if you are a diabetic, please control your sugars. If you are a person with blood pressure, please take your medicines. Don't forget. If you have a cancer patient, please take your drugs. Important is your comorbidity must be decreased so that you are unlike a comorbid. Mortality will be decreased if you are not comorbid. You can't change age, but try and see that blood pressure, diabetes, you're taking a statin, you're taking aspirin, don't stop it. These are drugs, please continue. So these are extremely important. Second, if you are used to taking vaccination for pneumonia, influenza, which is generally recommended in this weather, take these vaccinations. In fact, corona is kind of a flu virus. Nobody knows whether it will help, but there is a possibility that taking influenza shot or a pneumonia, a pneumococcal vaccine jab might help you to a large extent. Another area where UK has given a recommendation is for vitamin D. It's a good immune modulator. The immunity of vitamin D modulation has benefits. So in all viral infections, you can have vitamin D. Zinc has benefit, vitamin C, some benefit, some may not. So what I'm saying, what people can do sitting at home. Now the most important thing is your virus and the mask.
Right.
I brought it here. When I go to the ICU or for my rounds, I'll wear double mask. One is this mask. Suppose you can't afford, you're a common person, then you use a cotton which is at least 100 yarns per inch, slightly thicker. The better is 600 threads per inch. But if you can't, double layer of 100, 200 or 300 is better. Second, whenever you are using a mask and speaking, I have closed my rooms, no one around in my office, but please never take off the mask from your mouth. What people will do, they have this N95, they feel, oh, I am very well. But the moment they will speak, they will do this. They will go eat together. They operate, they take patients inside or out or talk to people. They will suddenly all sit together and do this. This is absolutely criminal. So never take it out. Both nose and face needs to be done. Now, why we use double mask? Because despite this mask, 1,000 viral particles can enter inside. So it's extremely important that in a high COVID area, doctors must be very careful. The next message I want to give is to the public. Please behave. Personal protection equipments, PPEs were not made. Country made a hell out of it. Import karo, ye karo, wo karo. There are no PPEs. This government is useless. But more important than PPE is PPM. Personal protection measures. Your own measures. What you do is a PPM. What is PPM? Your hand wash, your distancing, and your masking. You protect yourself. Everybody is protected. Therefore, please remember, more important than personal protection equipment is personal protection measures. Now, last and important is hospitals. Of course, hospitals and doctors have fatigue. They actually have worked more than anybody. You ask a soldier on the war front who has not for 8 months have slept, has not seen his family or has not eaten well. Well, that soldier cannot run with a heavy gun. And you expect doctors to run every minute and get their blood and all that, and no appreciation. Where is your abhinandan to these people? Anyway, coming back, what more we can do and what is important for us is to remember that the road is very bumpy. We have to be ready till December 2021. For example, you go to Mata, you go to Vaishnav Devi, and you have to climb. And you know that you have just covered 2 kilometers, and there are 8 or 9 kilometers. Everybody say Jai Mata Ki, and you will start going up, even if you are tired. Please remember, we have a journey till 2021 December. Each one of us encourage others. The fatigue will only go. The social, emotional, all these fatigues can go if all of us are together. And remember, once you reach the top, you forget about your sickness, you forget your fatigue or tiredness. So if you are ready for next 14 months, I think we will win. But if you give up, if you say, I am fatigued, I am tired, am I mentally this thing, you will probably fall and the society will fall. So we, and as a doctor, as a clinician, and also as one who feels and works in this area, my suggestion is there is no question of fatigue, either mental, physical, social,
Sir, very
emotional.
well put. I mean, it answers most of the questions that people have in their mind. I'm thankful to you that you put it out in such a easy, listicle fashion. I also want to understand from you, sir, because initially the government of India was denying that there is any community transmission. There is a lot of talk about a third wave in Delhi. Have we entered a third wave, and is now Delhi completely into a community transmission, sort of a situation?
Well, this is something where the surveys would have helped. The 3 surveys and the 4 surveys Delhi government has done has shown the antibody positivity between 23 to maybe 29%. Had there been a total community spread, which I hope it is not, then the antibody levels would have increased 5% to 10% every month. Because if you are spreading to others, the antibody levels will also go up, which has not occurred. However, community spread means when you do not know how I got the virus, people come here to the hospital, they are standing in the queue, but the other guy is asymptomatic, he has no problem. And then they go home and find that they are positive. So when you do not know the source, it is community spread. What we need is not to get herd immunity through community spread. Herd immunity is when you have got immunity as a herd. A herd means 100 people, 100
Right.
animals, 60, 70 of them have. But it's a costly affair. So you can get immunity by vaccine or by herd. I don't think we should get it by herd immunity. There is a doubt that Delhi has a third wave. I do not deny it because the numbers are increasing. We do not know even the peak. Weekend we have less tests. But you tell me which other state is doing as many tests as Delhi is doing? Whole of UP, whole of other states are not doing 100,000 or 70,000 tests. The more you test, more you will find, which is good. So
Right.
because now when Delhi will decrease, other states might increase. This is my apprehension.
Sir, what about the plasma therapy? Because, there is a lot of ambiguity about plasma therapy. I remember initially when it was started, we had a conversation and you said that the results are encouraging. The government has been, there have been too many views which have been put out as far as the plasma therapy is concerned. I know for a fact personally in Delhi, there is a massive demand for plasma therapy.
Well, you have good memory, Ankit. We started on 2nd of July, the first plasma bank at the ILBS, and we were able to convince the government, the DCGI, on end of June that plasma therapy has a role. The reason was at that time, nearly 25,000 people using the Mayo Protocol at the US were given plasma. There was not a convincing data that it is good or it is bad. First, we must understand the difference between vaccine and plasma therapy. Immunotherapy or immunity being given from me to you is of two ways. One is active immunity. Active immunity means part of the virus, not the whole virus, is put into a cell or something and is given to you. Body thinks the virus has come and body makes antibodies. That is the vaccine. What is plasma therapy? Somebody had the virus. He made antibodies. Now these antibodies are available within 2 hours to you. Vaccine will take 1 month to make antibodies. But plasma therapy can give you antibodies within 2 hours. You get the plasma, you have the antibodies again, and it will neutralize. Now, why there is a debate plasma therapy is
Okay.
good or bad is because if you use, let's say you use a 2 tier hotel or a 5 tier hotel. So if the antibody level in the plasma is low, how can it be effective? भाई दवाई अच्छी नहीं है तो कैसे काम करेगी? तो plasma therapy, there are rules, and I am happy today
Right,
only the
right.
government of India, ICMR, has issued guidelines. For the first time, they have emphasized that the titer of antibody should be more than 640, and neutralizing antibody, which no one used to do, it should be more than 80. The ILBS plasma bank from beginning has always insisted
Okay.
antibody levels to be more than 60. So plasma therapy, if given in the first 3 to 5
Sir,
days of illness, is helpful and only in moderate disease. But it is not a magic bullet. It is just giving you antibodies and maybe some help can be there. I still feel, and I feel my colleagues would agree.
sir, there are
That,
now
yes,
Sorry, there are now, claims being made about various vaccines now which are 94% efficacy, and the hope is for a lot of people that very soon, maybe by January, Feb, there would be some sort of availability of vaccination which will start across the globe. How hopeful are you as far as these vaccines are concerned? And specifically these winter months, November to, Feb time, is it more conducive for the virus to grow? Are we now sitting at a risk where the virus can multiply faster than possibly it was earlier?
so there are three parts. First, let me just give you the last part of the plasma therapy. So if someone has been suffering from corona and has recovered, wait for 4 weeks, get your antibody levels, please donate, you will help. We have done more than 3,300 plasma given to the people in Delhi. The numbers have increased. I hope we get a feedback whether they are getting better or not. Voluntary donations are not as many as replacement donations. So Delhiites, come together, serve the society. This is the best prayer you can offer to the society and your colleagues, your family, your friends, and your parents. Now, coming to the vaccine game, I am really happy that the vaccines are there, but there are few issues. Before I even give you which vaccine or which is the safety. When you put in a vaccine, you put it into a cell. There are three major types of vaccine. You take a virus. Adenovirus is a virus which is commonly used to carry something. So you put some protein, some gene part of the coronavirus into an adenovirus, give it a shot. Body will recognize, yes, this is some part of corona, like a spike protein, which is the most problematic, and makes antibodies against, and you are protected. Second, you can use one part of the gene, which call a messenger RNA, put it there, body makes it. The third way is use a DNA and make into a vaccine. All these are, or you use an inactivated virus and use it. These are standard techniques for making except the mRNA, is a standard techniques for a vaccine. Now, 5 companies have been listed. Let me tell you, the Pfizer vaccine, very promising, very standard company, has 2 problems. It has to be at minus 76 degrees stored. You can't have a freezer of -4, minus 76. And it needs 970 people at one line. You open the box, you have to
Okay.
give that. Second, the best probably is the Sputnik vaccine, which is the Russian. I'm not in favor of any country, but just to tell you that it is
Okay.
lyophilized and it can be easily distributed. All other vaccines, the Indian vaccines, are good for 2 to 8 degrees. They have a potential, but my concern is about the safety. And of course, there is just an economist, a recent, today or yesterday, economist published a beautiful thing. It says that if the vaccine becomes available, 87% of Indians will get the vaccine, while maybe 20% of Americans will get vaccine, because in America the cost may be high. This is the first time India is on the top on the people who will get the vaccine. This is because of the policies of the government, maybe far-sighted, and also the vaccine production capacity. Let me tell you, if you give vaccine to all the rich countries, only 1/3 of the world will be saved. But if you give to all the poor and middle income countries, 2/3 of the world will be saved. So you decide, and therefore vaccine equity should be there. But also, if you are having some money, please give free vaccine to the next guy if it costs. At least you can do this in your lifetime. And if you have 5-figure, 6-figure salary, get for 10 people. आप बाहर खाना खिलाते हैं गरीबों को, मंदिरों में दान देते हैं, अरे भाई वैक्सीन दान दे देना, 100 लोगों के लिए वैक्सीन दान दे देना. And India is known to be philanthropic. I urge the people, make sure you list out how many people you will get free vaccine if they have to pay. I will pay for 100, I will pay for 1,000, I will pay for 5. I will not only pay for myself. So when the vaccine comes and if it is effective and if it is safe, let the society be ready. Science has done its bit. The society has to do its bit. Come up and become the best.
Dr. Sarin, I'm sorry, I'm completely out of time, sir. But very, very noble suggestions and important things that you have told us. Important also what Dr. Sarin is saying. Don't see it as a 100-meter race or we have already run too long and we get tired. We have to prepare ourselves for the next 14 months. It will be possibly December next year, then where we can, in fact, talk with some authority as far as whether this battle against coronavirus has been won or at which stage we are at. Please, as Dr. Sarin was telling you, don't let your guard down. This is going to be extremely detrimental, not only for you and your loved ones, but for the entire nation as a whole. Don't just be hopeful, happy, and careless because there is some announcement of the vaccine. It will take a lot of time for that vaccine to reach you and for some sort of herd immunity to progress. Thank you so much, Dr. Sarin, for giving us the time and speaking to us. Delhiites, the very important, in fact, all the measures that Dr. Sarin has told us to improve our immunity and what we can do as individuals to fight coronavirus. Quick break at this moment.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.